done, Ji.
Okay, so namaste everyone. Today our topic of discussion is about yoga and a general exercise. We are trying to, everybody can hear, right?
Yes,
can you hear? Everybody can hear?
We can hear you, Sunil.
Okay, excellent. Okay. So let's go to the next one, Jay. Okay, so this picture essentially summarizes in a simple way what is a yoga and what is an exercise in general sense. Obviously, when people go to gym, they are doing exercise, and when people are doing yoga, they are doing yoga. There is a misunderstanding what yoga is and how yoga is different from a regular exercise and physical therapy. So in my opinion, these are very drastically different with the different outcomes. So the intent is different, the process is different, and the outcomes are different. So obviously we'll go through some of the information here. I will present some data that is available. And of course, it is an emerging area. A lot of studies are generally needed, and there is not a lot of funding to study the effects of yoga in a Western hemisphere. So most of this data is here and there from major Ivy League universities and mostly from India. Next screen.
Sunil, we are not able to see your face fully, Ji.
Okay. Over, Ji.
Now, Ji, we are able.
Okay. So here again, it just gives a difference between the yoga and a exercise done at home or at a gym. So as I said, the intent, the process, and the outcome. So just think about these three things. The intent in yoga is a well-being of both body and mind. Whereas in a general exercise, the intent is very specific. You are trying to lose weight, or trying to thicken your biceps, or have six-pack, or make your heart fit, cardio. So very specific intent in an exercise. Whereas in yoga, it is a holistic approach. It is intended for whole body and mind. And it is also, of course, there are lots of other differences as well, and we'll go over one by one. And then I will show some examples of how yoga actually is doing better than an exercise, in my opinion. So results in yoga take longer term. So that's why people generally give up, thinking that it is not going to help. But anything that generally takes time will have a long-lasting results. Anything that where you get an instant gratification or quicker results, the results are generally going to be short-lived. So obviously the intent is different and outcomes are different there. And the intent here in yoga is, it is a product of a human spiritual quest and overall well-being. Keep it there, G. And as I said, again, the gym exercises is essentially a product of human material necessity. Material necessity, again, just to make sure, people can walk 1 mile in a short period of time or have some weightlifting. And yoga has 8 branches or angas in a traditional sense. Yoga has, Patanjali described it in a very systematic format. It has 8 branches. And obviously, if you follow the 8 branches, the result is guaranteed. And of course, the result takes time. In gym exercise, of course, you do get the results as well. You essentially do treadmill or dumbbells, and you obviously the goals determine what you're going to do at the gym. And there are lots of requirements for gym exercises. You have to consume certain food, you have to have certain equipment. In yoga, what you need is just your mind and body. You are the equipment, and you use this equipment for your well-being. No special requirements. So, and yoga makes a balanced sympathetic and parasympathetic tone. We'll talk a little bit more down the road. And exercises generally increase a sympathetic tone. This is a key difference. The reason being, more sympathetic tone, more anxiety, more stress, and more after fatigue. So while you're doing yoga, you will be sweating, you will be stimulating the muscle. But once you're done with exercise, you are left with fatigue. And that's why a lot of people who do exercise at a gym come back and they feel exhausted, and they need these energy drinks to stimulate their body, because their body is having excessive sympathetic activity. And then once it is done, they crash. Of course, they have big muscles, but they have excess sympathetic tone. So most of these people may be even taking medications, and of course, maybe for psychiatric reasons, because they have reduced attention span also. Whereas yoga increases the attention span and it lessens the after fatigue. So while doing yoga and even after doing yoga, you feel the same, which is basically balanced. And you feel flexible in your muscles, you feel stretched in your joints, and you have a toned body. You won't get a big muscles, and obviously you won't strain your joints and a spine like in a exercise. So overall, the outcome is going to be a calm, content, balanced mind and a flexible muscles, agile joints, and a toned body in yoga. Whereas in a physical therapy / exercise, yes, you are going to do strengthening of the muscle, but you're probably going to strain your joints and spine, and you are probably going to be left with some stress and after fatigue after the exercise is done at the gym. Next slide. So the key 9 benefits of yoga. So as we just talked about, strength, balance, and flexibility. So that's a very important thing, because that's where exercise doesn't provide you. It provides you strength, but it doesn't give you a balance of body and mind. It gives you stiffness, doesn't give you flexibility. So yoga gives you flexibility, and regular exercises gives you stiffness. And a lot of times people who do exercises often tend to have joint pains and back pains because they are doing overstretching. And in yoga, it is not about overstretching. It is yoga is asanas in yoga are defined as stira sukham asanam. Stira means stable, sukham means comfortable, and asanam. So any posture that is stable, comfortable is asana. You stretch, not you twist and contort like what modern people think about yoga is. Yoga is not about contorting your body in odd postures and trying to create some kind of sensation. It is about moving your body, stretching your muscles and joints in a comfortable position, stretching a little bit more and more every day. And it essentially, because you're stretching the joints and muscles and spine, your arthritic symptoms, spine, back pain, and neck pain, and joint pains tend to be better and relieved. Whereas if you're walking on a treadmill, you are putting a lot of strain on your joints, on your spine, neck, lower back, ankle, hips. You're putting a lot of strain. So over a period of time, people who are doing a lot of treadmill tend to get a lot of joint pains. Whereas yoga, it is more about a stretch. So you don't get that pain, you actually relieve that pain. And of course, you get heart benefit because it not only strengthens the muscle contractility of the heart muscle, which is the strength of the heart muscle, but it also balances the sympathetic and parasympathetic tone on the heart. Whereas your exercises, they make the heart muscle thicker and its contractility improves, it stiffens, and over a period of time, your sympathetic drive is too high and your parasympathetic drive is low. So, and that's where another difference comes from. And people who do yoga, since they have very balanced sympathetic and parasympathetic tone, they tend to sleep better, their heart rate is slower, and their ability to cope with stress is better. Whereas people who do a lot of exercise, they come back and then they stimulate their mind and body in the morning with stimulants, and then in the night, they have to take some inhibitor medications like sedatives to go to sleep. Yes, they have big muscles, but they have to get these chemicals to control their body in a general sense. And you can also see that your mood is much better with yoga. Particularly, I'm talking about all aspects of yoga, not just asanas. A lot of people in the Western hemisphere think yoga is asana. And I mean here, all eight, at least asanas, pranayamas, and some meditation. So at least these three should be together to be called as yoga. And it helps to manage your stress better, and you feel much more cooperative, and your teamwork skills will be much better. You are not going to look like competitive. You're going to be very cooperative in people who do yoga and practice it on a daily basis. Next one. So again, very simple way to understand. One of the Harvard publication. People trust some Ivy League schools, although that's not my understanding, because good data can come from anywhere. But most of the people, if it comes from big universities, they give a lot of weight to that. So that's why I pulled it from Harvard Health publication. So looking at here, so yoga gives benefit in not only in the heart, overall fitness, weight control, and your appetite is also going to be very balanced. And a lot of people, when they go to gym, their goal is lose weight, have a good fit heart, have some cardiovascular fitness. And yoga can give you the same benefits and much more. And in fact, far more than that. So in my opinion, yoga is far more advanced technology than a simple physical therapy or a exercise or gym exercise. Next one. Next one, G. Okay, so this is timeline of what the different benefits. And I particularly pulled this one because yoga results take time. Some results you can get it very quickly, particularly with asanas, like if you have neck pain, sciatica, low back pain, arthritic pain, those mechanical things improve a little bit quicker by asanas. But certain other things like sympathetic and parasympathetic balance, your anxiety, stress level, sleep, memory, focus, attention. So these ones take time, and these need sadhana, the consistent effort, which is called sadhana. So you need that sadhana. A lot of people give up very early thinking it's not working. But once it starts working, you will enjoy doing yoga on a daily basis because those results are sustained and you don't have to invest just other than your time and effort. There is no other investment to make because your body and mind is your equipment to do the yoga. And here, one thing I liked in really well, obviously this slide, I pulled it from some online website. The source is quoted there. I don't know whether they got it from somewhere, but one thing I like there is altered gene expression. This is my personal understanding. A lot of people blame it on their genes because when I see patients in the office, whether they have anxiety, depression, or MS, or any neurological or medical problem, psychiatric problem, first thing they say is, oh, my mom and dad has it. So good, they gave me bad genes. And they try to put the blame on something that is external and somebody else and do not own the responsibility. So even though somebody may get the genes for a disease, in fact, you can alter the expression of the gene with the change in behavior and change in lifestyle. So, and this is very well proven, and this is where modern medical science is going. Alter the gene expression. We don't need to alter the gene. We can alter the gene expression, and this doesn't need medicines. This needs just change in behavior, and yoga is a perfect tool to alter this gene expression. Next. So, and again, very simple. This is pulled from National Institute of Health. It explores the effects of yoga on the quality of life. I will just read it from here, so you can go to the source and read more. So, while modern medicine has ability to cure acute diseases, physical and psychological, it is merely a medical approach and far less effective in healing the emotional component, intellectual and personality components of human body. And the discipline of yoga offers individuals a time-tested and a holistic model. And of course, it is not going to work for acute problems. It is mostly for chronic problems. And that is what the world is suffering from now. Chronic problems, whether it's physical or mental. Acute problems, yes, we can easily handle surgical, antibiotics, those things are there. But if you do yoga, most of these chronic problems, which is where most of the people suffer from, will improve. And there is an indisputable data, and that it improves the physical and mental well-being. And of course, it also smoothens the mind. The thought process becomes smoothened. A lot of people just say, give me some Xanax or some sleep medication. I can't sleep. There are thoughts going all around my mind. Even at 10 o'clock in the evening, I'm laying in the bed, my mind is racing. Yes, they have big muscles, and they fit in terms of heart function. They can run 1 mile in a short period of span. They can pass a treadmill test, but they are having this problem, sleep problems and anxiety. So yoga also helps here. It helps to smoothen this thought process, and you can consciously make it suppressed, and you can induce the sleep much easier. You don't need any pills. Next. So this is one of the study by University of Bristol. The source is quoted at the bottom. In this study, it is a workplace. What are the benefits to the employer? Let's say you are working at a big company and they want to boost the productivity. You don't need a Fitbit. You don't need to give a bonus. You can just let them join a yoga studio and you will get much better results than giving them bonus or Fitbit or making them run like 1 mile. So here, 72% reported boost in time management compared to non-work days. So because it improves the focus, the time management obviously improves. 72%, very dramatic. And 74% manage their workload better. And it is very important. I see it, I'm a solo practitioner with few employees. And I see varieties of employees. Some employees are very good at time management and workload management. Some employees will get stressed out. They have to go out, and I know some of the employees, not mine, but some of the other places, they go out and smoke just to get their mind active again. So because they can't balance, they can't multitask, yoga gives that ability to balance their workload, and which is tremendous productivity. And of course, they are dealing with stress much better. They are not taking off. So less off days for the employees. And they feel motivated and to work. And on the top of these 4, I'll add, they feel very cooperative with others. Their team skills, their team working skills become much better. They feel like they are working together, not competing against one another. So it's not going to be a dogfight. It is going to be teamwork, and yoga gives that mental stability to work in teams much better, because they become much more empathetic, not competitive per se. Next one. So these are some of the yoga postures, asanas, specifically the asanas of yoga. Okay, I'm not going to degrade yoga just by saying asanas equal to yoga. Yoga involves multiple steps. As I said, it is Patanjali described it as 8 angas, 8 limbs, but at least minimum 3, some physical postures, breathing control, and meditation, minimum 3. So this is mostly about physical. And you can also incorporate some breathing related techniques while you're sitting on a chair. And this reduces your back pain, neck pain, carpal tunnel syndrome, sciatica, and a tremendous improvement productivity, because they feel much more focused. And if employers can incorporate this maybe 5-10 minute sequence once in the morning and once in the evening, I believe there will be a tremendous improvement in productivity. And now a lot of people are working from home. If they can let them do this sequence on the Zoom or some other tool, and just 10 minutes, I think the productivity will be much better, focus will be much better. Next one. Yoga is not just for adults, it is also for children. And I will go through some of the data, how dramatic the children are suffering from, although a lot of parents may not realize, or they don't want to discuss about the medical and psychiatric aspects of the children, but the number of children suffering is very high, and only a portion of them are seeking medical attention. And so, next one. So these are some of the benefits for the children. So they obviously, they feel like very calm, they focused, and they will be able to do their homework better, and they will be able to interact with their colleagues, like the other students and teachers better. And so they will not feel stressed out. So, and their growth will be, their mental growth and physical growth will be much better. And of course, yoga with pranayamas also gives a better lung capacity. So if you get infected with COVID-19, you probably have a very good likelihood of recovering easier and quicker if you are a yoga practitioner than a simple gym person, because your muscles are not going to help you recover. If you have a bad pneumonia, you need a good lungs as well. And at the same time, you need a good immune system, and that comes from yoga. And I do not think exercise alone can give you a good immune system. Next one. So, and these are the benefits of yoga in children. You can read out, and I'll just go through a few of them. Yoga is non-competitive. So it is, it's a key. It's non-competitive because it improves the awareness and makes the person very empathetic to others. So their cooperative skills become much better. They work they want to help others to improve as well, besides improving themselves. Unlike becoming competitive, and in a competitive environment, they want to prove that they are superior to others. Here, they want to prove that all of us are better together, and their self-acceptance will improve, and it improves focus. And of course, now a lot of kids are suffering from ADD, attention deficit hyperactive disorder, and some of the kids PTSD with the various things going on in the family and things at home. That's how they have no focus. So they want like Adderall, they want these pills to help them focus. And I have seen multiple kids and even parents coming and, okay, my kid wants to study for medical school, but they can't focus. And apparently they can, they have ways to tell the physician, particularly their primary care doctor, if they go, to give them the exam that looks like ADD. So the kids go to like internet or talk to their friends and say, hey, if you want to study more, we can't focus. So we need a medication to focus. You need Adderall. To get Adderall, you need to get ADD diagnosis. How do you get ADD diagnosis? You go to your doctor and tell that you have these symptoms. They'll give you this questionnaire, and then you answer like this. It's a questionnaire, you answer like this. And then you get this score. And this score, you get diagnosed of ADD, the doctor will prescribe Adderall. All this to stay focused, because Adderall apparently helps them focused as long as the medication is working. Once the medication is gone, metabolized, they crash, they feel fatigued, and they feel very disjointed. Whereas yoga helps you remain focused all the time, and there is no pill. So, and a lot of times I encourage parents, yes, I can prescribe medication, but it should be a short-term goal. And the long-term goal should be to wean off these medications as quickly as possible. And I always suggest yoga is a perfect technology. You can go to YouTube or join some yoga studio to get those benefits. Next one. And yoga is also for seniors. A lot of seniors suffer from sleep problems, chronic conditions, hypertension, diabetes, back pain, joint pains. And so yoga has a tremendous value for seniors. So there is no time missed. So you can start it anytime. So, and we can go to the next slide. So, and it reduces the drug usage in children. So as you can see, 20% approximately, children and adolescents use at least one prescription drug. This is in the US. So 1 out of 5 kids in the US in the adolescent, up to adolescent age, according to this study, are using prescription medication. That is affecting the growth of the body and mind. So obviously it is giving temporary improvement, but it will have long-term consequences. So with yoga, they will be able to come off these medications, because that will give some results, but it takes time. So that's why the persistence is a key here. And here, the last one, you can see the most common therapeutic class prescribed in children was CNS agents, central nervous system agents. Almost 1/3 of these children who are prescribed these medications are getting this brain medication that are affecting the brain and mind. And that, in my opinion, is a disaster. And this is only going to get worse with this COVID situation and everything. This is just only going to get worse. And then we are already seeing it. This data is from 2014. And if this survey is done now, I suspect this is more than 60, 70%. Next one. And this is a therapeutic drug usage in adults. And as you can see, 50% close to described using a prescription drug in the past 30 days. So when they asked this question to 100 people or certain number of people in this survey, and what they said is half of them used a prescription drug in the country. So essentially chemical usage to control the body and mind. So, and this essentially is a big industry. So again, this is my personal opinion. I think there is not much incentive from either governments or schools or any institutions or pharmaceutical industry to make yoga a tech tool or technology, because there is not much big money involved there. Pharmaceuticals, big money. These are funding various, in elections, and the number one lobby in elections is pharmaceutical industry. And so you can guess where this interests of pharmaceutical industry is. It is about usage of medications. And simple technologies like yoga doesn't fetch you any money, and it doesn't benefit economy, but it benefits the people. But nobody wants to propagate it. So it is up to yoga practitioners to describe these benefits to children and to employers and to patients, and doctors have to describe this to patients, so that it becomes a commonplace. Yes, you can still use medications as long as, but over a period of time, you will be able to come off them or reduce the usage or dose or frequency of these medications if you practice yoga on a daily basis. Next. And this is again in the patients who have back pain. So people who are using yogasanas have reduced the usage of NSAIDs, non-steroidal anti-inflammatory drugs. As you know, chronic use of NSAIDs will lead to kidney damage, gastritis. Of course, this is all just a band-aid treatment. As long as your blood has this medication circulating, you feel that there is no pain. As if you have a crack in the wall, but you just switched off the lights so that you don't see that crack, but the crack is still there. So the medication is just putting a band-aid on your problem. It is not solving the problem. Yoga has a potential to solve the problem. Next one. And this is again about blood pressure. So it can reduce the blood pressure, reduce the headache, carpal tunnel syndrome, very common chronic problems that affect the productivity of an employee, productivity of a children, learning ability of children, and a lot of cases of disability, and not only in civilian, but also in veteran population can be improved by using yoga. And in fact, VA actually uses yoga in their treatment protocols. Next one. And this is a study on yoga, how yoga compares with the diet. A lot of times we talk about DASH diet. Diet to reduce hypertension. So, okay, reduce your salt, reduce your calories, do some little bit of exercise. So that's basically is a blood pressure treatment along with pills. And this one compared it with the yoga, and yoga did actually better in improving the blood pressure. And that too, no, only investment is you and time, no pills, no money involved. So essentially it's a practice that helps you. Next one. Because of the time constraints, I'm just going a little bit faster. So yoga improves sleep and psychiatric disorders. On the other hand, your exercise most of the time, it makes this problem worse. People are more anxious, they have more sleep problems. In people who are building muscles, are doing this fitness programs, are drinking this energy drinks, these are all stimulating, and they cause more imbalance in sympathetic and parasympathetic system. And their sympathetic tone is high. Whereas with yoga, your parasympathetic tone improves. And so you feel much more balanced, and you can induce sleep by yourself anytime. And so you don't have to depend on a pill to induce the sleep. So yoga has a tremendous value in psychiatry and also in improving sleep without the use of medications. Next one. And of course, how yoga works. This needs a lot of studies. And I don't think there is enough money invested to research how yoga works, but we know it works because it is there for thousands of years and it has been time tested. It is not about testing for 6 months or 1 year and telling this is the result. It is being tested for thousands of years and same results. It works. It takes time, but it works. And some of the studies showed that it improves GABA, which is a neurotransmitter, which is considered as an inhibitory neurotransmitter. It calms the nervous system. So yoga apparently improves GABA. And people who practice yoga, do sadhana of yoga on a daily basis, or at least a routine basis, they have thicker insula, which is a part of the brain that also affects the emotions. So their emotions they're less emotional. They don't fluctuate in terms of emotions. They're very calm and balanced. And we know that brain is plastic. Entire nervous system is plastic. What you think, what you do, your brain and nervous system molds in that direction. So with yoga, you are calming the brain. So your entire nervous system is going that way. So it is rewiring the brain. Again, this work takes time. It optimizes hormonal balance. People who have thyroid problems, there are certain yogasanas which you can do, where, like bandhas example, which you can do simple 5 minute, less than 5 minutes, in fact, and it optimizes your thyroid function. And you can do asanas for your testicles, your ovaries, obviously adrenal glands. So it optimizes all the hormones. And of course, the bigger one, the sympathetic parasympathetic balance you can achieve using yoga and not with exercise. And this is one of the study that shows this improved levels of GABA, which is a neurotransmitter with yoga. Next one, Jay. Again, this is my claim. If everyone does yoga in the world, we can significantly reduce disease burden, decrease pharmaceutical use, and create a balanced, content, empathetic, and successful society. Yoga is the best cost-effective treatment that is available. And again, I believe it from my heart. And obviously, if somebody has to prove, they need a lot of resources to prove it. But this is the best proof we have is time. It has been tested for thousands of years and the same results were achieved. So that's why I'm able to make this bold claim. So to end again, we started with, is yoga and just an exercise? And I want you to take this point now that yoga is much, much more than an exercise. It is not just about body alone. It is not just about a body part alone. It is about a holistic approach involving body, mind, and personality. And it has a long-lasting results, and it makes a person much more empathetic, calm, and balanced. So I wish everybody success in doing yoga, at least weekly or daily basis. And you can consult various resources. There are free resources online you can do. You can just put a YouTube video and just follow it, or join some yoga studio, or just go to some Zoom sessions, varieties of resources. So there is no reason to give an excuse that they can't do it. If you have 15, 30 minutes of time that you can invest, I believe you will benefit from it. I will now open to questions. And sorry, Aditya ji, I think initially we were supposed to get some survey of what the understanding of audience was. I think I completely forgot about it.
No problem, Ji. I think what we can do, Ji, is if you don't mind, Sunil Ji, we can take the question.